could offer one tip or direct your focus to one area to target that would improve plantar fasciitis the most, it would be to improve foot strength. In the most recent studies regarding PF, weakness of the intrinsic muscles of the foot is one of the top 3 causes of PF. Unfortunately, correcting weakness in your foot is not even on the short list of the recommendations most people are given. And to make things worse, the solutions most of you are offered only further weaken your feet and leads to chronic PF. In this video, I will share the importance of foot strength, but more importantly, I'll share the 3 primary causes of weak feet, and of course, what to do about it. Also, a little later in the video, I will share 3 simple exercises to strengthen your feet and reverse your PF. I'm Dr. Angela, and I'm the Plantar Fasciitis Doc, and I'm all about helping you resolve PF at home. Now, let's get into it. I specialize in plantar fasciitis, and I have treated thousands of cases. I wanted to share with you the experience of one of my most recent patients and see if you can relate to her story. Her name is Sarah, and she has had PF for almost a year, about 10 months. She's in her 60s and has recently retired. She's an avid walker and walked daily with a group of women every morning in her neighborhood. One weekend, she went hiking with her husband. They hiked more miles than they usually do, and she wore some older hiking boots that she hadn't worn in a long time. They were restrictive and tight around the toe area. She began to experience very sharp heel pain that was worse with the first steps in the morning. She had to completely stop walking with her morning group. Now here's the part I believe you will relate to the most. She went online and read several articles and started stretching her calf muscles. Then she went to a running store and bought a pair of Hokas that she read was the best shoe for PF. Those things didn't help, and she still couldn't walk without pain. She decided to rest for a couple of weeks. She went to see her regular doctor, who suggested a cortisone shot in her heel. That lessened her pain for a month or so, but she said she knew it hadn't corrected anything. Next stop, a podiatrist. He took an x-ray and fitted her for orthotics and recommended NSAIDs and told her to apply ice 3 times a day. Again, no help. This went on for 8 or 9 months. She was desperate for relief. She found my program, and in our first conversation, she was shocked at how many things she was doing wrong. Has your PF journey been similar to Sarah's? Can you relate to the frustration? The worst thing for me is that with multiple doctor visits, there was no discussion of the importance of correcting the underlying cause, no conversation about implementing strengthening and mobility protocols, and she was given no actionable advice or even an explanation of what really was going on. Only recommendations for short-term band-aids that only further weaken her feet and prolong healing and cause more long-term damage. They completely missed the boat. That's why the information in this video is so important. I help people break free from the cycle of short-term fixes and focus on correcting the structural issues that led to your PF. So when she came to me, Sarah had incredibly weak foot muscles. She could hardly perform the simple muscle test I was giving her. I put Sarah in the Ultra Rivera, a transitional shoe that has a wide toe box, and began to slowly transition her out of her Hokas and also out of her orthotics. She had some malposition of her big toe, meaning it had started to shift inward from years of wearing dress shoes to work. I prescribed the use of toe spacers to help realign her toes and gave her specific strengthening and mobility protocols to improve foot strength. I'll share those a little later in the video. That's our focus today, learning to ditch the band-aids and target the underlying cause. Before we get into the details, I have a free guide with the exact steps I used to resolve Sarah's PF. Put the word guide in the comments and I will be sure you get a copy of that. The small muscles of our arch are called the intrinsic muscles of our feet. I like to call them your foot core. We used to believe that the intrinsic muscles only controlled a couple of actions in the feet because they were so small. However, with newer research, we have better insight on how important they are. These tiny muscles are incredibly significant and play a huge role in providing built-in shock absorption. They also contribute significantly to the ability to balance. This is really important, especially with the older community and preventing fall risk. They also provide power and strength for running and jumping. Even elite runners and athletes will see better performance with stronger intrinsics. So no matter who you are, you can benefit from a stronger foot core. If you have weakness in these muscles, you are susceptible to a whole host of foot conditions, not just PF. These are the three main causes of foot core weakness. Number one is wearing footwear that narrows at the toe. When we wear shoes with tapered toe boxes, our feet and toes cannot spread out as we walk and run, and our feet are unable to function normally. Our foot muscles are weakened and lose the ability to absorb shock. Most conventional footwear have narrow toe boxes, and this leads to PF. We need shoes that support the natural shape of our feet and allow for normal toe splay that are widest at the toe, like these. I have an approved shoe list with the shoes I approve and recommend for plantar fasciitis. Put the word shoes in the comments and I'll be sure you get a copy of that. The second cause of a weak foot core is wearing foot orthotics. Hearing this may confuse you. This is often one of the first things people are told to do to correct PF, just like in Sarah's case. She didn't know this would further weaken her feet. Foot orthotics are one of the biggest roadblocks in healing PF. Our feet are naturally strong and do not need this type of support long term. Using an external device like an orthotic is a temporary solution and doesn't address the underlying cause. A practitioner would never put a cast on a broken arm and recommend that you wear it for the rest of your life. Once the tissues and bones have healed, you remove the cast and begin to strengthen the muscles that have been immobilized with bracing. However, with a foot orthotic, there is a neglect to implement an expiration date. Having this type of support in the early phase or acute phase of PF can be helpful. However, wearing them beyond that is detrimental to your recovery. This also applies to shoes that have built-in arch supports or anti-pronation technology, like most running shoes, Birkenstocks, and UFOs. Shoes that have motion control and corrective technology will actually weaken your foot and can lead to exactly the thing that you're trying to correct. Our feet become lazy and dependent on these external devices. The third cause of weakness in your feet is not walking barefoot. This is one of the most common myths regarding PF. I know most of you have been told to avoid barefoot walking if you have foot pain, but this is one of the healthiest things you can do for your feet, and it naturally strengthens your foot core. It may be difficult to walk barefoot when you're in a lot of pain, but as your feet get stronger from the exercises I will show you in a minute, you can begin to slowly introduce your feet to this new concept. Many studies have shown that barefoot cultures have little to no foot problems and have significantly straighter, more aligned toes and stronger arches. What does this tell us? Our conventional footwear with narrow toe boxes are destroying our feet. It takes time to train your feet to enjoy barefoot walking. I recommend starting to go barefoot for 10 minutes each day, then increasing the time each week. Also, another way to strengthen your feet is to wear toe spacers. Toe spacers are a tool used to help stretch and realign your toes from the damaging effects of narrow toe shoes. These made a big difference for Sarah. They also help broaden the base of your feet, which allows you to use your foot core more optimally. They help to restore the natural shape and function of the feet by fanning the toes out into a natural position. If you wear your toe spacers during physical activities such as yoga, running, weight training, or wearing them in your wide toe box shoes, you can further enhance the corrective benefits. As I mentioned earlier, I want to show you the 3 best exercises to strengthen your feet. Number 1 is short foot exercises. Number 2 is towel grabs. And number 3 is toe spreading. The first exercise is short foot exercises. The goal of the short foot exercise is to shorten the foot by contracting the intrinsic muscles to raise the arch. First, make sure you're barefoot and stand on both feet. Evenly distribute body weight over both feet. Then, spread your toes as far as you can. Make sure all your toes are in touch with the ground. Without scrunching your toes, try to shorten your foot by bringing the ball of your foot towards the heel, doming the arch in your feet, while pressing your toes into the ground. If performed correctly, you should be able to feel a strong contraction in the muscles under your foot. If it feels like it's going to cramp, that's a good sign. That means that you are recruiting the right muscles and doing the exercise correctly. If you do begin to cramp, pause for a moment and then resume. You can focus on one foot at a time or do both at once. Contract the arch, shorten your foot, and hold the short foot exercise for 2 seconds and repeat 10 times. Perform the exercise 1 time per day, and as your feet get stronger, perform them twice a day. The second exercise is the towel grab. With your toes on a towel, flex and scrunch your toes, pulling the towel towards you. Be sure you keep your heel on the ground. Squeeze and hold the contraction for 2 seconds for 10 repetitions. This can also be adapted to picking up golf balls, marbles, or another object that causes your toes to flex and your arch muscles to contract. Perform the towel grab exercise 1 time per day and work up to twice per day as your feet get stronger. The third exercise is toe spreading. Toe spreading involves spreading your toes away from each other as far as you can. Spread your toes and hold the position for 5 seconds and repeat 10 times. It may seem difficult at first. You may also notice that one foot is easier to spread. This is an indication of more weakness in one foot. Continue to practice each day, and you will notice a greater range of motion each week. These aren't hard, it just takes more practice for some. This is one of my favorite exercises to practice throughout the day. Another factor that could be limiting your ability to increase strength is the presence of fascial adhesions in the soft tissues. If you have restricted fascia, you will not achieve adequate strength in your foot core. I shot another video on how to remove fascial adhesions. Watch that one next. I'll see you there.